Essential tremor is a common movement disorder. If you have it, you'll notice rhythmic shaking that you just can't control, usually in your hands, though it can also show up in your head, voice, legs, or trunk. The tricky thing about essential tremor is that it gets worse when you're actually trying to do something. Reach for a coffee cup, the shaking intensifies. Trying to write, same deal. But when you're at rest, it tends to calm down. This is what we call an action tremor, and it's the hallmark of the condition. It can definitely mess with your daily life. Those simple tasks we take for granted can become frustrating. In the brain, there are abnormal signals firing in your nervous system, particularly in the cerebellum. That's the part of your brain that helps coordinate smooth, controlled movements. When those signals get disrupted, you get the tremor. Today we're going to discuss some innovative, maybe controversial methods to help you tame your tremor.
So if I try to outstretch them, then they really shake.
In about 20 seconds or so.
Okay.
Right one seems not bad today, but
Okay.
Essential tremor is a common movement disorder. It frequently affects the hands, as seen in these three cases. The important thing to note is how it can interfere with daily function, like using your cell phone. The cerebellum, shown here in red, is a key player in the essential tremor circuit. Here's what makes it interesting. Large diameter peripheral nerves feed directly into the cerebellum, giving us a potential entry point to reset the circuit and calm down the tremor. We've already talked about studies that stimulate nerves in the hand, but there's another approach worth knowing about: vibrating balls. These devices vibrate at the same frequency as your tremor, which is actually brilliant when you understand the mechanism. Vibration is a powerful way to activate those large diameter nerves we just mentioned. So when you hold a vibrating ball, you're essentially sending strong signals through the nerves in your hands and wrists straight up to your cerebellum, potentially influencing how it's functioning and disrupting that tremor circuit. The second powerful way to reach the cerebellum is through something called the dorsal columns. These are like superhighways running through your spinal cord that carry information straight up to the cerebellum. You can activate these pathways using non-invasive spinal cord stimulation. By stimulating these large diameter fibers in the dorsal columns, you're sending a strong signal directly to the cerebellum, which can potentially help modulate and reduce your essential tremor. It's another way to tap into your nervous system's existing infrastructure without surgery. The final method that profoundly affects the cerebellum is skull vibration using the Tone Pacer app with bone-conducting headphones. This approach works through two powerful mechanisms at once. First, the nature of the tones has a strong influence on your vestibular system, your inner ear balance system, which is intimately connected to the cerebellum. Second, because it's bone-conducting, it literally vibrates your skull, which excites those large diameter nerve fibers that feed into the cerebellum. So you're getting a double effect: vestibular stimulation plus direct mechanical vibration of the skull. It's one more way we can try to recalibrate the cerebellum from the outside of the body without any invasive procedures. Now let's see if it works for ET patients.
This way we have something to... Pretty good. So this is July 1st we're doing this. 2015. This. Can you bring your hands together for me? So that looks a little bit better, I think. I don't know what you think.
Okay. Good.
That should be good, Laura.
Did you get them? They seem even more steady than yesterday.
Really?
Yeah.
This one's like not even moving.
No, I know. It looks good.
Okay, try and do your phone. Okay, so that didn't really...
Better.
Much better.
Wow.
Excellent.
So the stimulation on my spine is what, and the adjustments is what I started with, and I had really, really amazing success with that. And now we're adding the ball, and I'm just starting that treatment. But when I came here for my last treatment, I had gone under some very stressful personal situations. So when I came here, I did feel like my tremors were actually starting to act up again, and that was when I used the ball for the first time in conjunction with everything else I was doing, and I immediately, while I was having the treatment, started feeling better, and it's been really good.
Good.
Okay. So before I came in for treatments, I had been also seeing a naturopath, and I was working on a lot of detox, and so I actually probably started feeling a little bit better than my normal when I got here, but my tremors were not gone by any means. I was still having them. My hands were still shaking pretty aggressively, especially under times of stress or fatigue or just not eating well. Like, my hands were very noticeable. I couldn't carry a glass of water across from my kitchen, across my kitchen, just in my house by myself without spilling it everywhere. I had almost immediate response once I started the treatment here. I would say that the response was short, so I would have the treatments, I would go home, and probably for a day I would feel better. But with the extended amounts of times I came, I was able to stretch out the length of my my progress. So instead of like going for a day of feeling well, I would go for a few days and then a week, and now we're at 3 weeks. And so I'm definitely would say that I don't even notice my tremors anymore. I'm doing things I never thought I would be able to do, like order a glass of water in a restaurant and actually drink from the glass. Like, I used to bring my own sippy cups. Those are things that I would never have been able to do, and now I just do them without even thinking.
That concludes our discussion for today. I hope you found this information valuable for your clinical practice. Thank you for your attention, and I wish you continued success in your work with patients. I hope to see you again at a future lecture.